ground, if there are any new measures put in place to ensure that we contain the further spread of the coronavirus, is it now extended to the rest of the country? Are there any new measures in place, or are those that have been there still the same?
Thank you very much. Generally, the measures that are taken or will be taken under the new lockdown are not fundamentally different from what is existing. First of all, the borders will remain closed, except for people that are coming in who are Namibian citizens, the holders of permanent residence, and people that are domiciled in Namibia will be allowed to come in, provided that they undergo a mandatory quarantine by the Ministry of Health, as well as the trucks that are bringing in essential goods will be allowed in Namibia. And also those coming from the neighboring countries in search of medical treatment, especially those who are on chronic medicine, they will definitely be allowed. Or, of course, their entry is strictly monitored by the law enforcement. At time, the law enforcement will help them to access their medicine under strictly supervised conditions, so that they do not mix with the population.
Thank you very much, Honorable. We understand that part of the extension there was a necessity to zone the country into certain zones. Why did that happen, and what are these zones of the regions?
The zoning is basically a clustering of regions. Clustering of the region in terms of the physical characteristic of those regions, the type of road networks, and the interdependence between one region with the other. For example, Zone 2 or Zone 3, which is Ohangwena, Oshikoto, and Oshana. What we've looked at is that these two regions, Oshana and Oshikoto, and Ohangwena and Oshikoto, cannot do without Oshana, because most of the activities, the shopping, the hospitals are in Oshana, and therefore it only makes sense that you cluster that within the same same zone, so that people are able to travel, to access medical services and other necessary services in Oshana. So they will be able to travel in between. However, the travel within the region, within the zone, is also will also be subjected to strict control. You do not just move anywhere, because lockdown by definition is everything comes to a standstill. People must stay home. So the movement even within the zones, will still be subject to control. There will be roadblocks and checkpoints even within the same zone, so that people that are traveling are the ones that are going for essential services.
So now that the zoning has happened, will there be checkpoints in bordering between two zones as well to mitigate people traveling between zone 1 and zone 2, for example?
Definitely, there will be checkpoints between between the zones, as well as checkpoints within the zones as well, and also then the checkpoints at the border post, for example, and border post and entry points. So border posts are the ones that are gazetted, and crossing points are the ones that people normally used to cross, but they are not gazetted. At time you find that some of the crossing points even accommodate a volume of movement than the crossing points. So all those ones will still be meant by the law enforcement officers.
So Honorable, the understanding is that now that the lockdown has extended to all the regions, the measures that were put in place in the Khomas and Irongo regions continue to persist and to run along, for example, some of the guidelines of the state of emergency. How will this affect the lives of those now that are in this other 12 regions to which now the lockdown has been extended to them?
Obviously, the life of the people during the lockdown will be affected. Life will not be the same because by nature of the lockdown, or let's say the state of emergency. So the state of emergency simply means that certain things, certain rights will be forfeited. Forfeited in the sense that the rules governing the state of emergency take precedence, and therefore a lot of things will not be the way they're supposed to be. So the life of the people will definitely be affected. So so the economic cluster actually meets regularly to look at how the life of the people are, especially the livelihood of the people are affected, and come up with possible solutions to mitigate the effects of the lockdown. For example, the emergency income grant has been rolled out, and people have started receiving some payment to ease the suffering that they are going through during the lockdown. It is also being recommended that the vendors will be allowed to sell their goods, especially those ones that are selling food items. So they will be allowed to do their business under strict conditions. That is the observance of the social distances, and also the hygiene factors, washing of hands, and that the vendors are not. I mean, the customers, the vendors do not allow their customers to sit in and consume what they have bought from them. So you buy and you go. So it is really urged that once that happens, the vendors must pre-package their products, and the customer will just come and buy and go home, so that we prevent the congregation or the the grouping of the people.
All right, now, there are some who are arguing that, of course, it's necessary for these measures to be put in place, especially at times such as this. But what can you say to convince those that are still under the impression that perhaps the lockdown or the extension thereof is not necessary, especially in a time like this where we're trying to stop the further spread of the virus? Would you say it's necessary to put some of these measures in place to limit people's movement, to limit people's freedom in exercising some rights, and to allow us to curb the further spread of the virus?
It is very necessary because when we limit the movement, we are actually limiting the interaction. And the virus spread through the interaction, through conduct. So it is better to stay home other than to exercise rights. Yes, it's good to think it's my right to move around. But when you become infected and you infect the other people, you will not say, yeah, I was exercising my rights. So when you get sick and other people get sick, when the situation get out of hands, we then realize that it was actually necessary. We don't want to go to the extent as where other countries have gone. In some countries, it's reported the hospitals are running out of facilities. The mortuaries are full to the extent that the bodies are actually stored in the trucks. So look at Namibia. How many mortuaries do we have? For example, if we come to a situation where you have 2,000 people dying per day, or 2,000 people that will need ventilators or whatever that they need. How do we have all those facilities? So if other countries, bigger countries with or bigger economies, are finding it difficult, what about the smaller economy? So we really need to control the spread of virus before it gets out of hands, because there is more cost to the spread than the cost to the control.
Thank you. There's a question around documents. If I would like to get through the checkpoints that have been put up in the zone or at the borders of two zones, what documents do I require, and what other circumstances can I use to travel?
Basically, when you are traveling within or between zones, you need written authorization. And this written authorization must indicate whether your travel is necessary, either for medical purposes or for rendering essential services. And this written authorization should be issued by the Ministry of Health if it's for medical reason, by the Ministry of Trade and by the Ministry of Trade if it's for commercial purposes, when you are delivering essential service, commercial service, but which is categorized as an essential service. And of course, by the Ministry of Home Affairs, Immigration and Safety and Security. So those are the documents that you need. But for you to travel also, to get those permits, you also need some supporting documents. Some people goes to the authorized officers. I want to go to zone whatever, I want to go to this, to point B, without necessary documents. So you will really have to have proof that your travel is really necessary so that you will be given. At this point, probably I need to urge the authorized officers or who are issuing permits to be more strict and look at the results. Some people will come to a person, to an authorizing officer to say, hey, I want to go and pick up a child from the other side who went for a holiday. Some of those issues can wait until the lockdown is lifted. People must also remember that the lockdown can only be lifted when the chances of the spread of COVID-19 has been minimized or completely eliminated.
So you are saying, Honorable, that should people continue to try to break the measures put in place, this lockdown could be extended. It really depends on people's behavior that whether this lockdown will end or not.
Definitely the spread of the virus is dependent on the kind of a behavior that we portray. If we are moving around and the virus continue to spread, then more measures will actually been taken, and it will even affect us more. So it's better to stay home and until so that we control the spread of the virus, and then. Depending on how well are we doing, then the lockdown might be lifted.
We also understand that there are those who have been breaking the measures put in place, the regulations, and some have been fined, some have been arrested because of that type of behavior against the measures put in place. Where have these people been detained, and what is their status of detention?
Yeah, no, indeed we have the law enforcement has been hard at work. A lot of people have been fined. So, some have been able to pay. Others have not paid yet. But we are very conscious of the fact that people might be infected. And because they are infected, we have decided to say, we'll not put them into the cells. Because they might, again, people coming from outside bring in new, virus to the people that are already in the cells. So they are basically issued with a ticket. And this works like the traffic fine. So where you are given a ticket, you go and pay to the nearest magistrate court, or you opt, if you think you are innocent, you opt to wait for a particular date that will be indicated on the ticket to appear before the court. So they are not detained. They are at where they are, in their own houses, until such a time that they appear in court.
When are they expected to settle? Is it now indicated on the ticket when the expectation is to settle their fees?
The date to settle the fee is indicated on the ticket. But then if you wish, you opt not to pay, there's also an indication of when you appear before the court.
All right, Honorable, we also would like to know about the issue of outdoor exercises. There has been two conflicting sides. The nation feels that because they are cooped up in houses, they have the opportunity to go out and exercise. And it's part of the regulations that you can go out in groups of 3 for exercise, jogging, stretching, whatever you would like. However, we have also seen that on the other side, people are congregating in large groups, actually going out in groups of more than 10 actually to jog or exercise and sort of in a way breaching the regulations put in place against this. Perhaps could you just explain to us really what is now the stance around this and how can we caution those who are sort of within their rights to jog and exercise, but also breaking the number of people that should do so at a time?
So, generally, the regulations have allowed people to exercise. And it allows, as you said, it allowed people must not be, that are exercising must not be more than 3 in a group. But that does not mean, because we came from one household, we are 3, we can join the other family, which is 3 and become 6, it becomes a problem. So again, when you are you are 3, you still need to maintain a distance. So what we have witnessed, there are so many people in the streets, especially here in Windhoek, especially in the Somuith Road. You will find a lot of people, just the number, the size of the soccer match, and they are congregated at the particular place. That is not acceptable. So when you go out to exercise, you should strictly be, if you are many in a group of 3, and still the social distance must be maintained. If the law enforcement find you in a group, you will not be able to say, no, we are only 3 from our household. So as long as there you are a group, then the law enforcement will actually get involved.
Thank you very much, Honorable. I now give the opportunity for media houses to ask questions around the discussion we're having here on the zoning, on the restrictions of movement, and the regulations extended. We have a gentleman over there, gentleman over here, and a madam over there.
Good morning, Honorable Deputy Ministers and Erica Shona. My name is Denver Kisting. I'm here in my capacity as a journalist working for a Republic newspaper. I've got a few questions for the Honorable Deputy Minister of Home Affairs, Immigration, Safety and Security. Firstly, he just informed us that the law enforcement officers have been hard at work at enforcing and policing the regulations and the compliance thereof. I'd like him to please shed some light on the prohibition on the sale and purchase of alcohol. We've heard reports that top government officials have, during the lockdown period, been arrested for drinking and driving allegedly. So will there be greater pressure on those officials? Secondly, we understood that although the list pertaining to providers of crucial services wouldn't be reduced, that it would be enhanced to include other service providers. For example, a retail store selling winter clothing. Have those been included? Equally, we understand that the authoring and spreading of fake news would have been criminalized. Has that also been given effect to? As far as he's concerned, that's it for now. Thank you very much.
All right, thank you very much. Should we do responses or more questions?
I'm not too sure if I got the first one. I'm not too sure if I got the first one. Is it the sale of alcohol?
Yes, is the banning, will it still be in place of the sale of alcohol now throughout the country now that we have extended the lockdown?
Yeah, yes, the sale of alcohol is still prohibited under the new regime of the lockdown, and there is a possibility, and we are proposing from the safety and security that the regulations actually need to be strengthened. They need to be strengthened because at the moment what is prohibited is the sale, but not the possession. Now, people go behind closed doors, they buy alcohol, and now when you find that person with alcohol in the streets or wherever he is, he's not selling. So he's just having it. So we want us also actually we are proposing an amendment to include the possession of alcohol in the public places. So now people go behind closed doors, they put they buy their liquor, put them in the bags, and then they go and consume. So what we are saying is we want also to the regulation to be strengthened to empower the law enforcement also to intercept those kind of people that are doing that.
Okay. The second question was around essential services, especially around, now that we're approaching winter, will it be extended to closing shops that sell winter clothes as a necessity at this point?
That is not a security question. But as I said, the economic cluster is always meeting from time to time. That question probably belongs to the committee on that cluster. And as we go on, government will look at what is necessary to be done in order to alleviate the problems that arises from the lockdown. Definitely, if that will need to be done, it is to the decision. It's a decision that will come from the bigger committee, probably on the recommendation of the cluster, of the economic cluster committee.
All right. And if I get it correctly, the last one is around the criminalization of fake news. Mr. Kisting would like to know if the regulations are going to extend to criminalize those that are spreading fake news, especially around now the COVID-19 pandemic.
I think if there will be amendment to the regulations, we still have to have to wait. Probably by the end of the week, before the new regime of the lockdown, we'll be able to know if there are new regulations. But for now, we are working on the existing regulations. Of course, there are discussions here and there from various committees as to what are the issues that will be done or needs to be done, and what regulation need to be strengthened. But that will have to wait until we cross that bridge when we get there.
Yeah. Maybe just to add on that as well, this will require the gazetting of the extension of the lockdown. So once that has been come into place, I'm sure it might cater some of those issues, but if not, it's an ongoing activity. All right, there was a question from the gentleman.
Thank you so much, Honorable Deputy Minister and Honorable Kashikola. My name is Kevin. I'm an anchor on Eagle FM. Yesterday and today, we had a situation on the checkpoint. That's the Oshiwarongo Okahanya checkpoint, where we have got hundreds and hundreds of cars that are locked in a long queue. And some people have spent 11 hours and slept over the past night. And they are complaining that at the checkpoint, there are only 2 nurses that are serving them. And they are saying that as a result, the emergency which they wanted to attend to, on which they were given their travel permits, there's no longer any emergency because they are now being made to stay there for longer hours. Are we thinking of dispatching more nurses to try to make sure that we lessen the pressure on the roads?
All right. Thank you very much, sir. Yes,
Yes, the issue of the long queues at the checkpoints have come up quite often. But what I want to assure the nation is that it is not deliberate. It is the issue of manpower, as you said. I remember we are using men and women with blood and flesh like any other person. And of course we don't have the necessary number that we would require to man all the checkpoints. First of all, we must understand that now the issue of coronavirus has not stopped the normal policing duties. Sometimes a person is supposed to man a roadblock, but then there is an incident where the police officers or law enforcement officers needs to attend to. So you might then sacrifice one or two to attend to another thing. One other thing that is also holding up and causing long queues is the kind of permits that are presented at the checkpoints. There are checkpoints where it says, for example, the permit that says the reason for traveling is personal. Now, it is not very clear. You expect that such person will be subject to scrutiny to determine whether that travel is actually necessary. Or you are driving a truck with goats or with cattle, but there are no proper documentation to prove that those cattle are yours, they belong to you. You expected that it will take a bit of time for the law enforcement officers to scrutinize, and obviously that will contribute to the time it takes. But definitely, it's our intention to improve on those queues, but we really need the cooperation from the public, those who are issuing permits, and those who are asking for permit, to make sure that they have their clear documentations, that the permits are very clear, so that you don't have a lot of questions at the checkpoints. So the only assurance that I can give you is that it has never been our intention, and it will not be an intention of government to derail the process.
I don't know if I could just add the Honorable Kashikola. Also, those who would say we have heard reports of those who are taking chances as well and not having the proper documentation or using fake documents are actually derailing those who might have emergencies. So really, I think the call is for those who are unnecessarily going out and going to these checkpoints, might be delaying an emergency of someone who actually needs to go through the checkpoint. So really the call here is truly that if it's unnecessary for you to travel, one, do not travel, because you could be spreading the virus, or you could contract the virus by being around people, a lot of people at a time. But also secondly, you might be putting somebody else's life in danger who might have needed the assistance to get through that checkpoint. Thank you very much for that.
Good. Definitely that they are also chance takers. Our officers in the field have reported the encountering certain permits that are not signed, for example, or signed but not stamped, and all these things, this scrutiny that is involved in trying to determine whether this is genuine or not, it will actually lead to the downtime.
Yeah, thank you very much. Yes, madam, the floor is yours.
Good morning, my name is Jemima Beatrice from the Namibian Sun newspaper. Honorable Kashikola, I want to bring you back to a question asked earlier by my colleague Dan McKisting about senior government officials who are violating the regulations by driving around under the influence of alcohol. Can you please tell us whether there are any strict measures on dealing with these individuals? And then because of these individuals, we now sit with a situation where the citizens are saying these people must present good examples. So if they're not setting those examples, we will act the same way. So we have people acting out and going around drinking because this is the example set by senior government officials. Can you please tell me what is your message to people saying that? And then there's the other issue about some people are saying they do not necessarily go and buy the alcohol. But what if I stay in Kadatura, I have a well-to-do cousin staying in Eros who has some bottles of wine, and I go and get some of those. Is that allowed? Can I go and get alcohol somewhere else and take it to my house and drink it there? Honorable Esther Munyangwe, there's some nurses are saying they live in fear because often these cases, these coronavirus cases, just land on their hands without them really being prepared, mentally, even physically. Some of them are concerned about the lack of materials such as masks, gloves, and even PPP. Can you please tell us how is the ministry dealing with the situation? Are they giving these people support, some kind of psychosocial support or something like that? Thank you very much.
Thank you very much. So we'll start with you, Honorable, to respond to some of those questions, and then we'll give over to the Honorable DM Esther Munyangwe, who's here with us today from the Ministry of Health, to give us a health update and also answer that question that has been raised.
I didn't get anything from there.
Okay, all right.
I didn't get any.
Oh, her name?
No, the question.
Oh, the question,
it's
okay.
It's not clear here.
Okay. Yes, ma'am, you can ask the question again.
Honorable Kashikola, my colleague earlier said or raised the issue about senior government officials driving around under the influence of alcohol, violating the regulations and even the laws of this country. So can you please tell us what strict measures, whether there are any measures in place to deal with these reckless individuals? Thank you.
Okay. Thank you. The normal law on with regard to the reckless driving and driving under the influence of liquor applies. If you are caught, regardless of whether you were caught with alcohol or you were selling alcohol, for as long as you have been found driving under the influence. So the law deal with you in terms of the law enforcement officers will deal with you in terms of the law, and you will be given fine. You will be treated in the normal way as it has been done even before the coronavirus. The only thing that I probably need to say here is we might go to the extent of then asking further to say, where did you find the alcohol that we have consumed, so that we have a lead to where alcohol is being sold, and the police or the law enforcement officers will take action against the perpetrator in terms of the regulations under COVID-19.
I think that might also be a response to the second question, because the second question was, let's say I have a family member who in their house has alcohol. I go get it, and then the police now find me on the streets having this alcohol. I didn't necessarily buy it, or that person didn't sell it to me, but I obviously went to acquire it from somewhere. Will the regulations perhaps extend now into that?
That is why I said for now the regulation prohibits the sale,
Yeah.
And not the possession.
Yeah.
But our recommendation is that we need to strengthen the regulation to include the possession of alcohol. But the possession here mean when you have it in public
Not at
or
all.
in a public place. We are very conscious that there are people who, for example, collect wine.
Yeah.
And they have wines in their houses, but they are not necessarily consuming it. They keep a certain number of liquor, wine collectors, for example. But then if you get it from there and you are found in the streets or hidden in your car, the boot of your car, when the law enforcement searches, then the regulation must make provision for that, so that you are dealt with accordingly.
Thank you very much, Honorable. We now invite Honorable Dr. Esther Mwinyangwe to give us a health update. And I would like to stress that the updates we have here are just that, they are updates, but there is a question that is indicated to you. And as is always, our panelists or people here at the center always stay after the sessions to answer any questions. The floor is yours, Honorable.
Thank you very much. Honorable Deputy Minister, good morning, Deputy Minister. Morning to everyone here. Of course, the daily update, we don't have new developments. We still have the 16 cases, of which 4 have recovered. I just want to say something on there was a question on the nurses too at the checkpoints, right? One thing that we also need to take into account very seriously is the fact that when you see all the cars that are passing through the roadblocks, one is really wondering, where are all these people going? Because the purpose of lockdown is to minimize the movements of people. That is very, very important. And that also comes back to the question of if I have a friend or a family member who is having alcohol in his or her house, and I want to go and get one bottle of wine there. Of course, it's not about whether you have bought it or got it from someone. The purpose is to minimize the movement of people. And that is why it is clear, the protocol is clear that when you are moving, it's only when you go to the pharmacy to get medication or you go to the shop to buy food. That's it. Alcohol is not essential at the moment. And I'm happy that we have the lockdown, because people who thought that they cannot live with alcohol, now they realize that in fact, I can do without it. So, the question of the nurses at the roadblocks, we are making sure that at least we have 2 at every roadblock. But now we are seeing more movements of people, and that makes the work difficult. So we are at the moment, the ministry is now busy also recruiting extra staff members or human resources, because we also have realized that at the roadblocks, some of the works that need to be done there is the completion of forms and so on. You don't really need a nurse also to do that. So you can get people who are able to read and write, who can do that, so that we can also make the work of the nurses more, easy for them to carry out what they have to do there. The psychosocial support to the nurses, of course, I have been saying here that as a ministry, we are fully aware of what our health workers, especially nurses at the front line, are going through at the moment. A lot of people are coming, and we keep on saying that when a person arrives and presents himself or herself at the health facility, no one knows whether that person is infected or not. So that makes it difficult also to know when to provide that social support to the nurse or not. But what I want to emphasize is that we are not aware, or our office was not made aware of any nurses who were feeling overwhelmed and who were not provided any psychosocial support. And I want to emphasize that in every organization, there is a structure. And if there are nurses who feel overwhelmed, I'm sure they have supervisors that they report to. So that would be very good for them if they can approach their supervisors and, express their feelings of being overwhelmed or uncertain, because we do understand that in this time, they would have a lot of ambiguous feelings that they are experiencing, because it's a new disease. Everyone is anxious, everyone is terrified. So it's okay for them to feel like that. But they should talk to their immediate supervisors so that the necessary psychosocial support can be provided to them, because we do have people who can provide that support. And lastly, it is on the issue of authorization. We also are fully aware that people are now misusing this as well, because people don't want to stay where they are. Now they are going to whoever, and they are getting authority to travel. They make copies and they give to friends and so on. It's where you find people, more than 20, going to the same funeral. And so they are, and it's very easy in Namibia to obtain a death certificate, for example. So people are misusing that. And I want to appeal to the Namibians out there that we should also not wait for the law enforcement. In this time, which is so critical, we need to be policing ourselves as well. My minister yesterday said, maybe we need shock therapy, and I don't know what that would be, to make people realize that this is the reality that we are dealing with. The virus, COVID-19, is real, and you still find people who are not taking it serious. So please, people, minimize the movement of people, because if we allow people to move, it defeats the purpose of the lockdown. Thank you so much.
Thank you very much, Honorable DM. We're now getting to the conclusion of our discussion. I'd like to ask Honorable Kashikola to then just give, in conclusion, really what the new measures would require for every individual in this country now that the lockdown has been extended to comply with, but also just caution them around breaking some of these regulations that have been put in place.
Thank you very much, Comrade DM. As you rightly said, the lockdown is now being extended to throughout the country. Our expectation and our plea to the Namibian people is to obey the rules. The rules are very simple. You stay home, do not move around, only move when it is necessary. You are going to a shop to buy bread, you are going to a clinic for medication, to a pharmacy, you are going to perform an essential service. Apart from that, the message is stay home. And the law enforcement are under strict instruction to ensure that they control the unnecessary movement. Of late, we have witnessed an increase in the volume of traffic in and around commerce, especially in the city of Windhoek. We would like to see that that traffic being minimized. We would also like to see people in the people that are in the streets, also the number having drastically reduced. If not, so where possible, the law enforcement will act. Of course, the law enforcement will act professionally. That is their instruction. They will act professionally to make sure that we are actually protected against the coronavirus. If one is affected, it will definitely affect the family, and then the family will affect the neighbor, and the neighbor will affect the community, and it goes on like that. So I would like to repeat that there is more cost to the coronavirus, to the spread, than to the prevention.
Thank you very much, Honorable Kashikola. Ladies and gentlemen, that brings us to the end of today's session around zoning of the different regions as we extend the lockdown to the rest of the country, as well as the restrictions of movement that are strictly enforced to protect you and I from contracting the coronavirus here in Namibia, but further to ensure that we are able to adhere to the regulations put in place to protect the lives of those who are risking their lives on the front lines, that is our nurses and the law enforcement agents who are waking up every morning to ensure that you and I are better protected from the virus. So let us not go against this, fellow citizens. Let us work with our law enforcement agents and our healthcare workers to ensure that we keep the numbers low, that we stop the spread of the coronavirus, and that we do our bit and our part by staying home, continuously washing our hands, and ensuring that we practice social distancing to ensure that coronavirus does not take over our country. We are going through a difficult time as far as it is already. Our economy is taking a big hit. All of us are experiencing some type of discomfort, but if we do not comply with these regulations, fellow Namibians, this extension will extend beyond the 5th of May. So I implore of you to adhere to the regulations put in place by the Ministry of Home Affairs, Immigration and Safety and Security, and all the other government agencies to ensure that we get out of this alive and healthy and get back to the thriving and functioning society that we know as Namibia. That is all we have today at this hour at 10 o'clock in our debrief. We ask you to join us again at 4 o'clock as we discuss higher education issues around e-learning and the launch of the high-level committee of COVID-19 in the high-level sector. That is all from us. Have a blessed day.
Whether your travel is necessary, either for medical purposes or for rendering essential services. And this written authorization should be issued by the Ministry of Health if it's for medical reason. By the Ministry of Trade by the Ministry of Trade if it's for commercial purposes when you are delivering essential service, commercial service, but which is categorized as an essential service. And of course, by the Ministry of Home Affairs, Immigration and Safety and Security. So those are the documents that that you need. But for you to travel also to get those permits, you also need some supporting documents. Some people goes to the authorized officers. I want to go to zone whatever. I want to go to this to point B without necessary documents. So you will really have to have proof that your travel is really necessary so that you will be given. At this point, probably I need to urge the authorized officers or who are issuing permits to be more strict and look at the reasons. Some people will come to a person, to an authorizing officer to say, hey, I want to go and pick up a child from the other side who went for a holiday. Some of those issues can wait for until the lockdown is lifted. People must also remember that the lockdown can only be lifted when the chances of the spread of COVID-19 has been minimized or completely eliminated.
So you are saying, Honorable, that should people continue to try to break the measures put in place, this lockdown could be extended. It really depends on people's behavior that whether this lockdown will end or not.
Definitely the spread of the virus is dependent on the kind of a behavior that we portray. If we are moving around and the virus continue to spread, then more measures will actually been taken, and it will even affect us more. So it's better to stay home and until so that we control the spread of the virus, and then depending on how well are we doing, then the lockdown might be lifted.
We also understand that there are those who have been breaking the measures put in place, the regulations, and some have been fined, some have been arrested because of that type of behavior against the measures put in place, where have these people been detained and what is their